Hey everyone, I'm Darlene, the Cosmetic Coordinator here at the Park Clinic for Drs. Chris Park and Dr. Ryan Rebo. I have Dr. Park here with us today, and we're going to talk about a lower body lift.
So what we're trying to do is talk to people more about things that aren't as common a terms. I mean, somebody may not even know what a lower body lift. They know what a tummy tuck is, they know what a buttock lift is, they know what a thigh lift is. So a lower body lift is kind of a combination of three things. It's a tummy tuck in the front, it's a buttock lift in the back, and it's also a little bit of a lateral thigh lift. It's not going to get your medial thighs, but it does pull up on the lateral thighs. So when we see patients, we always are going to look at all of those components. So we get patients all the time that come in and say, I'm here for a tummy tuck, but we're not going to ignore the sides and the back. They can choose to ignore it, but if I see a patient where the laxity doesn't stop and it just kind of keeps going all the way around, then you're going to need a lower body lift. And it's really can be done at the same time. There's some pros and cons, which we'll kind of go over today, but it's a fantastic procedure, and it's one that's almost essential for all these patients that are having this massive weight loss. So people are having massive weight loss because bariatric surgery's come such a long way. They're gotten safer, and then a lot of patients just doing it on their own. I mean, we're getting healthier as a society, and we have patients come in all the time that lose well over 100 pounds on their own. And if that happens, you're gonna have loose skin. And people always say to me, I'm gonna go to the gym and work it off. Like, you'd have to gain so much muscle mass to tighten up skin, it's literally impossible. Exercise does nothing for your skin. So when we see patients with loose skin, we're gonna address it. Obviously people know, like I said, about tummy tuck, but if on the back the buttock has deflated and the volume has gone down and it's saggy, and especially if there's rolls or wrinkles, but even if it's almost pretty but just loose and moves more than you want it to, and it's more in the bottom of your shorts than you want it to be, then if we do the tummy tuck, which we pull kind of down or way down in the front, but on the back we mainly pull up. You know, we're not pulling the back down, we're pulling the buttock up. And in between we have a transition zone, and in that transition zone we also are going to scoop up the lateral thigh and lift up what we kind of call saddlebags or trochanteric excess and pull that around, and it's one continuous scar. It tends to scare people a little bit because they're like, oh my God, you cut me in half, but we're only cutting the skin. We're doing some deep layer suspension so that you get a good result, but it's really three procedures in one that a lot of patients can accomplish, and it's amazing. It's a good starting point for those weight loss patients. So the way we do it, which people just find interesting, is obviously how you go all the way around on somebody. So it is a surgery where we do put you in multiple positions during the procedures, and it obviously takes longer than when you do one of those procedures on their own. But the recoveries are similar, so they're all going to be about a month. So instead of having 3 months, you're going to have 1 month. The main cons are that we can't quite pull each one as tight as we would as if we did them by themselves. So if I wanted to get absolutely as much as I could get out during your tummy tuck, I'm going to pull it super duper tight. I'm going to keep you extra hunched over for a week and gradually stand you up. But we can't do that if we're also pulling on the buttock, because when you pull on the buttock, you might pull that incision. So we basically pull you to where you have to stay neutral. So you're not hunched over, which means we take about ½ inch or so less from the stomach, but you lay on, so you can walk standing straight up, you can lay on your back, lay on your sides, lay on your stomach. You're not stuck in one position, but you have to kind of keep tension off of everything. Also, the ways that we've done it, you have to have drains with this surgery, but the way I do it, I have some special drains that I've ordered and used for years now that are a 2-in-1. So I used to be, you did 4 drains for the surgery, but with me you do 2 drains. And drains are not fun, but they're necessary evil. They usually come out in about 7 to 14 days, depending on how much fluid is coming out. It is a hospital type procedure. I do like to keep patients overnight in the hospital after a lower body lift for a couple of reasons. Number one, the positioning. You have to kind of learn how to do it safely. Number two, it is a longer procedure. It takes about 5 hours or so, which is kind of the max that I like to do for elective surgery. So I love the fact that I can keep you overnight and give you blood thinners to prevent blood clots until I know you're up and walking. We also are able to keep a Foley catheter in overnight, so you don't have to get up and go to the bathroom. which is kind of hard to do the first day. But by the next day, we're able to get you up and walk in and teach you how to do it safely.
Now, I understand with the tummy tuck, you tighten the muscles. With the body lift, you tighten the muscles in the front as well?
Yeah, the tummy tuck is essentially the same, except like I said, we might take just a little bit less off skin, but we do everything else the same. We do even more liposuction in a body lift than we do with an abdominoplasty. So, the main thing I like to tell people, again, talking about pros and cons, the main limitation, and I've already mentioned it, but you may not have understood, is we're not actually pulling the back down. The back is very heavily tethered in the lumbar region, and even pulling 5 inches of skin there is not going to improve back rolls. That's a separate procedure, and of course we don't want to cut your lower back and your upper back at the same time. So a lot of times we do upper dermal lipectomy that has a variety of names. You can call it a Trump lipectomy, you can call it a bra-line excision. So yeah, so I mean, people that need a lower body lift are probably going to know that they need it. They just may not know what it's called. But essentially, if you have trunk laxity, especially if you've had a lot of weight loss, we'd be happy to see you in discussion and consultation. I think we overpride ourselves on honesty. We're not going to sell you anything. We're going to tell you the risks and the rewards, just like I did today. I probably talked about the bad stuff as much as the good stuff. But it's an awesome procedure that is really, in most of my weight loss patients, where we start, because you get so much done in that first surgery that it's just amazing. So we're happy to talk about it in person, or we are doing more virtual consultations now during this COVID era. If you'd like to start with that, we can kind of review things. As long as you give us some good pictures, we'll chat about it. But ultimately, we want to get you here in person and get our fingers on you and see what all we need to do.